Hey friends, today we had a 60-year-old male patient who presented with complaints of dizziness for one day. There was no history of vomiting, and on examination we could not elicit any cerebellar signs, and also there was no nystagmus present. There was clumsiness present in all of his limb movements and he was too scared to walk. And then we saw this.
ধরে রাখো।
আমি তাহলে ফোন দিচ্ছি, আপনারা কথা বলে নেবেন কি স্যারের সাথে?
In this video, we can see non-rhythmic interruptions of sustained muscle contraction, which is consistent with asterixis. We sent an arterial ammonia, which came out to be 148, which is pretty high. So we made a diagnosis of hepatic encephalopathy.
Hepatic encephalopathy is defined as a brain dysfunction which is arising due to a liver disease or due to portosystemic shunting. If it is due to an acute liver disease, it's called type A hepatic encephalopathy. In case it is because of excessive portosystemic shunting, you can call it type B hepatic encaph. And if it is there in the setting of a chronic liver disease, you will call it type C hepatic encaph. Hepatic encephalopathy can be graded into 5 grades of severity. Grade 0 is the condition when the patient is not having any signs and symptoms, and only by special psychometric tests you can prove that the patient is in encephalopathy. Grade 1 encephalopathy refers to the condition when the main problem is altered sleep pattern and otherwise the patient is more or less okay. So grade 0 and grade 1 are considered to be covert hepatic encephalopathy, and you can also call it minimal hepatic encephalopathy. As soon as the patient is in altered sensorium, the patient becomes disoriented or the patient starts having asterixis, then it becomes overt hepatic encephalopathy, which can have grades from 2 to 4. In case the patient had no hepatic encephalopathy in the last 6 months preceding this illness, then we call it episodic hepatic encephalopathy. In case the patient had an episode in the last 6 months, then it's called recurrent. In case there was not much of an improvement in between the last and the current episode, then we can call it persistent hepatic encephalopathy. Finally, these are the precipitating factors of hepatic encephalopathy, and we need to mention them as well.
This patient never had hepatic encephalopathy in the past, and as he has asterixis, this makes it grade 2 hepatic encephalopathy. On questioning, he revealed that he is a chronic alcoholic, and also he had complaints of constipation in the past few days. We did a USG which revealed coarse liver ecotexture, so we made a final diagnosis of episodic overt hepatic encephalopathy type C, which was precipitated by constipation. Thank you guys for watching. We'll see you in the next video.